Washington, D.C. topped the list of America's fittest cities for 3 years in a row until now. In this week's edition of Today's Health, we tell you how the nation's capital has been dethroned. Erica Edwards has a story.
Who cares if it's cold in Minneapolis? Minnesotans simply bundle up and head outside to ski, sled, jog, whatever it takes to be physically active.
I like to walk even outside in the winter because it's gorgeous, even here in the winter.
Minneapolis and St. Paul rank at the top of the list of the 50 fittest cities, according to the American College of Sports Medicine and the Anthem Foundation. The annual report looks at heart disease and diabetes rates, smoking, availability of farmers markets, and whether cities are investing in natural areas where residents can exercise.
Washington, D.C. didn't pay as much attention to its parks. Not enough of an investment there.
That's one reason the Twin Cities pushed Washington, D.C. down to the #2 spot this year. San Francisco, San Jose, and Seattle round out the top 5. Compared to last year, 16% more people nationwide are getting enough aerobic exercise, and there was a 10% drop in diagnosed chest pain or heart disease. But obesity has risen, as have deaths from diabetes, and fewer people say they're in optimal health.
This is a time to be able to be much more mindful of every mouthful and every step.
At the bottom of the list, Indianapolis, Oklahoma City, and Louisville. NBC News.
In other health news this morning, a grieving father warns of dangers of caffeine after it linked to the death of his teenage son. 16-year-old Davis Allen Kripe collapsed in his classroom outside Columbia, South Carolina last month and died in an emergency room. The Richland County coroner calls his death a caffeine-induced cardiac event linked to Kripe's caffeine intake. The coroner reports the teen drank a large caffeinated soda, a latte, and an energy drink in the 2 hours before his death.
I stand before you as a broken-hearted father and hope that something good can come from this. Parents, please talk to your kids about the dangers of these energy drinks. And teenagers and students, please stop buying them. There's no reason to consume them. They can be very dangerous.
In other health news, emissions from diesel vehicles may contribute to thousands of premature deaths across the world. A new study from Environmental Health Analytics looked at nitrogen oxide pollution in 11 countries, including the U.S. Researchers found 1/3 to 1/2 of vehicles exceed the limits for diesel emissions, especially buses and heavy-duty trucks. These excess emissions were linked to an estimated 38,000 early deaths in 2015 alone. Current vehicles emit far more nitrogen oxides in real-world conditions than during laboratory testing. That's it for this week's edition of Today's Health. And coming up on KPVI News Today, we take a look at your KPVI News Today headlines.